when I think about steps, I think of it as a proxy for cardiovascular health because it's a measure of how much we move by our like conscious volition. And that in effect has indirect consequences because our cardiovascular system becomes healthier the more we move. And that effect is sort of into the future. And so it's a proxy, but we know that the relationship is true through a lot of studies. What I'm hoping to get at with this new metric, however, is to hopefully measure more directly your heart's ability to function. So if I could give you like an example, let's say that there's two people, each person taking 10,000 steps per day, but one person, their heart rate is much higher than the other person. And so what we would start to suspect is that that person's heart is actually working much harder than they have to under the same amount of exercise load. And so then we would sort of start to single those people out clinically and start to try to see if they have any early signs of heart disease. Um, and that's true that I think that's something that we truly believe in is that it's not just about measuring how fast your heart is beating or how many steps that you're counting, but rather your heart rate in the context of your the demand of your physical activity that actually reflects how your heart is doing. And we sort of show that in our clinical outcomes as well, that there's a stronger correlation. I think our study composed of two parts. One is looking at the correlation between people who are wearable users that have access to this particular metric and the same users who have linked electronic medical records to look at all of the diagnosis that they've had in the past and see, is there a correlation between my metric with any diagnoses that they've had in the past? And we see the strongest correlations tend to be obesity, type 2 diabetes, hypertension, and we know those are the major risk factors for major adverse cardiac events. Um, and when we look at in our study, what we then do is focus on the six cardiovascular disease outcomes like type 2 diabetes, hypertension, stroke, heart failure, coronary atherosclerosis, and myocardial infarction or heart attack. And to see actually if the odds ratios are higher, if if that actually the correlation stands, and that's true as well. Um, and then what's even more interestingly is that we know that the gold standard for diagnosing sort of coronary disease is a stress test. Is you get on a treadmill and you run, and they record your heart rate and your EKG, and what's output is a metric called the maximum metabolic equivalence, like sort of the amount of VO2. They measure the amount of oxygen that your body can consume, and what we found is that in the subset of people who also underwent concurrent stress testing, that metric was more strongly correlated with the outcomes of a treadmill stress test than just looking at um, steps and like daily heart rate. Because we really believe that when you look at the heart rate as a number outside of the context of that person, that their age, their sex, their BMI, and their level of activity, it doesn't really mean anything. Like we really have to take all of that into consideration to use that to hopefully find people with underlying, coronary disease.